Due to Fabry, I was unable to meet my grandfather, who passed away at the age of 42.
4 of my family members died from Fabry disease, all under the age of 50 years old.
Rebecca Bilo, and this is my daughter Adri Bilo, and we both have Fabry disease.
My name is Taylor Hoffman, and I have Fabry disease.
Originally diagnosed with Fabry is when I was 28 or so.
39 years old, I had Fabry.
I was diagnosed with Fabry when I was 20.
I was diagnosed with Fabry when I was 30 years old.
Diagnosed with Fabry disease a little before my 30th birthday.
2 younger brothers, one that's 3 years younger than me, had kidney failure before I did.
My younger brother, Ken, died from kidney failure caused by Fabry disease when he was only 37 years old.
My first symptom was when I was 10.
There's times that, as a mother of 4, I hurt too much to do things that my kids want to do, which makes me feel really guilty.
I've been symptomatic with my disease.
It's not something that is necessarily easy to take or easy to understand when you first get the diagnosis.
It takes over some part of my life.
I would love to be able to plan to have another baby and not worry about whether or not my son or daughter will have the same genetic disease that I have and how that's going to affect their quality of life. So Fabry disease is a hard thing.
What is Fabry disease? Fabry disease is an X-linked lysosomal storage disorder. Mutations of the X chromosome result in deficiency of the lysosomal enzyme alpha-galactosidase A. Lysosomes function as the recycling centers of the cell. They contain digestive enzymes that break down substances into smaller compounds. Deficiency in this enzyme results in progressive accumulation of globotriaosylceramide in lysosomes, leading to organ damage and premature death in men and women. This disease causes progressive damage to different organs and tissues. As this is a rare disease, with such a wide range of symptoms, it is frequently misdiagnosed. Genetic inheritance. As the condition is caused by a DNA mutation, it is a genetic disease and therefore hereditary. Fabry disease is an X-linked disease, which means that transmission is linked to gender as follows. As family members may be affected, even if they don't have obvious symptoms, it is very important to perform pedigree analysis and test relatives for Fabry disease when a diagnosis of Fabry disease has been confirmed. Fabry disease and women. In men, symptoms generally appear at an earlier age, are typically more severe and progress more quickly than in women. Women affected by Fabry disease normally become symptomatic when they are adults. The symptoms are less severe than in men, which is why female patients are often misdiagnosed. Signs and symptoms. Early symptoms of Fabry disease often appear in childhood and include pain in the extremities, fatigue, intolerance of physical exertion, hypohidrosis, gastrointestinal problems, and angiokeratoma. Patients with Fabry disease are also particularly affected by sudden changes in temperature or extreme temperatures. Symptoms that can be present in a large proportion of patients with Fabry disease include stress and fever. However, Fabry disease affects different organs, which require specific treatment. Disease progression leads to a variety of systemic manifestations, including manifestations of the nervous system, kidneys, eyes, skin, gastrointestinal tract, and heart. In addition to physical symptoms, many patients with Fabry disease also suffer from depression, which is caused by factors such as decreased quality of life. Also, patients often feel isolated and have to deal with a lack of understanding for their condition. Early diagnosis is therefore essential. Patients with Fabry disease can lead a normal life. It is important that patients describe all of their symptoms during medical visits. This includes telling their doctor how often their symptoms occur and how severe they are. Learning about Fabry disease can help patients gain a better understanding of their condition and how to manage it. The Fabry disease community can provide valuable support and information to patients and their families.
If you have tested positive for Fabry disease and been to the Royal Free Hospital for assessment, this short video aims to provide information on how the condition can be treated and managed. Enzyme replacement therapy is given by an intravenous infusion directly into the bloodstream. It works by replacing the enzyme that is deficient in Fabry disease. The infusions are given every 2 weeks. You will have the first infusion at the Lysosomal Storage Disorders Unit at the Royal Free Hospital, so you can be observed for a short time afterwards in case of any reactions. If all goes well, you will have subsequent infusions at home, so you will be able to fit them in around your lifestyle. At all times, you will receive help and support from our specialist nurses, and we'll make sure we see you every 6 months to see how you're getting on.
I've been on the enzyme treatment for about 8 months now, I'd say. Yeah, it's okay.
I have the enzyme replacement therapy. Every fortnight a nurse comes to my house and infuses me with it.
The infusions I have with my sister Cherry, who lives around the corner from me, so we have it together and chat and a cup of tea, and you know, so it doesn't worry me.
Yes, getting around the infusions is fine because I'm working now, so we kind of work around the work schedule because I'm on days and nights. It varies every week, so roughly 2 weeks, like 15, 16 days, we can do the
It is nice to have someone come to you as well, to have that little bit of a chat with someone that understands what the Fabry's is as well. So
living a normal life. So far so good, yeah. I have no complaints.
Fabry disease, with its many devastating symptoms, is hiding in thousands of families all over the world. The clues that would help physicians and families recognize Fabry disease are often overlooked. Fabry disease is often undiagnosed or misdiagnosed as many other conditions. When Fabry disease is diagnosed, it's often diagnosed too late after irreversible organ damage occurs. With treatment available, children should not have to live a poor quality of life, and adults should not have to die prematurely because of Fabry disease. Together, we can beat this disease. We need your help to provide physician, family, and public education to increase early recognition and diagnosis of Fabry disease, and to help people with Fabry disease better understand and manage their disease. Please make a tax-deductible charitable contribution to the National Fabry Disease Foundation today. Thank you on behalf of so many people whose lives will forever be changed for the better because of your generosity.